There is a place for every degree within public health.
We can use any degree. For example, if you're interested in being a health inspector, we call that classification in our environmentalist science degrees. Science degrees will get you into either our health inspectors, which are our environmentalists. It will also get you into the lab if you want to do lab work. So bachelor's degrees in science can get you into those fields. We have opportunities for nurses.
We offer nursing from just out of school, an RN classification with no experience necessary, and we take associate degree nurses, bachelor's degree, master's, and even doctorate. We have nurse practitioners at the county health department with their nurse practitioner degrees. So having the different classifications is very important because a student may start out as an associate degree nurse or bachelor's degree, and if they're working towards a higher degree, it will open other opportunities up for them within the department.
We have opportunities for business degrees. We have some, we call them health service administrators here in the department, and we need somebody with a business background.
For a health services administrator, I happen my undergraduate's in nursing, and then my advanced degree is in management. But we have health service administrators who have degrees in biology or management. We have other degrees that allow you to move into those types of roles. Even just having a bachelor's degree, you are able to move into those roles. But then as you see that there's something else you want to go into, absolutely, we encourage advanced degrees, but they're not required.
Within our bureau, we have a variety of classifications. We have social workers, we have health educators, we have health service administrators, we have ASAs. So there's a variety of career paths that we have within this bureau. Your career choice or your degrees that you want to look at, if you want to do health education, like going out into the communities and teaching them about COVID or tobacco cessation, that's a health education sort of kind of a degree. If you want to be like a social worker, which is more linking systems and services together within a community so the underserved can find those needed resources, that's a social worker. We have health service administrators. That individual sort of manages programs, sort of leads programs of the federal government side. So that's going to be a degree in public health. It could be a business degree, more management we're looking at that point in time. The Department of Public Health is a service industry. We're here to serve, and it takes a special person. But your mission is to serve.
One of the things that, like I think I mentioned earlier, that we really push is that independent and critical thinking. Because if you are if you're a nurse or someone else and you're giving advice to the public, and they're looking at you as the expert, you need to have those critical thinking skills.
So communication, so the willingness to serve, being able to work in teams. These are skill sets that are needed today. Everything we do in public health is about teamwork, it's team building, it's communicating, it's linking systems and services to individuals statewide and globally.
Currently, our division is made up of over 42 employees. We have over 8 sections within our division as well. We have accounts payable, we have grants and contracts, systems administration, budgets and receipts, payroll, cost accounting.
Here in our HR office, we have, I guess we have 13 employees for 3,000 statewide employees. It can be a challenge, right? With so many people, there's always something going on. I'm not somebody who likes the same thing every day, and so I don't have that problem in my role. Every day is different, especially when you're dealing with people and trying to help, with communication or trying to roll out some new project or something that the state health officer wants us to do. But if you like people, human resources is definitely the field to get into, because that's what we do all day.
I consider our bureau like the traveler's umbrella of public health. We have the Department of Pharmacy, Division of Pharmacy falls within our bureau. We have health marketing, video communications, a print shop, tobacco cessation, rape prevention, suicide, and the best of all, which I'm dealing most of my life with right now, is emergency preparedness. So a variety of different programs fall within this bureau that help us serve the citizens of Alabama.
Anything sort of disease related, somebody in my division is involved with from start to finish. It goes from school-borne outbreaks to an outbreak at a daycare. 10 people get sick after eating after a funeral or after a wedding. 10 little boys get sick after a baseball game. So if you name it, I've got staff involved in it. And we've got 83 central office employees that manage things here. I've got an additional 133 staff located around the state that do local response.
We are the regulatory bureau for the Department of Public Health. We regulate healthcare providers. We are under an agreement with CMS, the Department of Health and Human Services, to conduct the surveys or inspections for healthcare providers in the state of Alabama, throughout the entire state. That would be nursing homes, hospitals, hospice, end-stage renal disease, as well as clinical laboratories.
Currently, we just started this year a state accounting intern program, paid and unpaid positions. If you want more information for that, you can contact Ken Harrison within our HR department.
They could take advantage of the continuing education units. Those are offered to people outside of ADPH. They could also take advantage of clinical rotations for public health. We offer that at all of our county health departments. We would also offer internships if they just wanted to shadow and see what public health nursing was all about. That would be a great opportunity for them as well. Also within our social work division, and we would have opportunities for them to do an internship.
So if they really want to learn about public health, they want to get involved in shadowing, doing some internships, call me.